Welcome to The Explainer. Sometimes a stack of medical reports isn't just data. It's a story, a real-life mystery just waiting to be solved. And today, we are putting on our detective hats. We're going to dive into this file and decode a very urgent message that a patient's heart is sending out. So this is our very first clue. And yeah, I know, it might just look like a bunch of random squiggles on a page, but it's not. This is an electrical signal, a frantic SOS coming from a heart that is in very serious trouble. Our job is to figure out exactly what it's trying to tell us and why. Okay, so our investigation starts with that first alarm bell. We're looking at the heart of a 56-year-old patient, Iqbal Hossein, and right now it is in the middle of what you could call an electrical storm. We need to figure out what this signal means to understand the crisis.
Now that signal comes from something called an electrocardiogram, or an ECG for short. The easiest way to think about it is like the heart's own unique signature. Every single beat, every contraction, every little pulse of electricity gets captured in these lines, painting a picture of the heart's health in real time.
And to someone who knows how to read it, this signature tells a whole story. The official conclusion right there on the report is acute inferior wall myocardial infarction. So, what does that mean in plain English? It's the unmistakable sign of a severe, ongoing heart attack, and it's affecting the bottom part of the heart, the inferior wall. Remember that detail, okay? It's a huge clue. So, we know what is happening, a heart attack. But the real question is why? What's causing the heart's entire electrical system to go haywire like this? Well, to answer that, we have to look beyond the electricity and start searching for some physical evidence.
And that is exactly where our next set of clues comes from. The medical team turned to the patient's blood, hunting for the chemical footprints that this crisis would have left behind. See, the blood holds secrets that even the ECG can only hint at.
And boy, did it have a story to tell. Once we look at the numbers, things start to get a whole lot clearer. Let's break down what they found.
First up, we've got this number, 0.0443. Now, this is a measurement of a protein called troponin I. And you need to know, in a healthy person, this number should be practically zero.
This patient's level is more than double the normal limit. Troponin is a protein that's supposed to stay inside the heart muscle cells. When those cells get damaged and start to die, it leaks out into the bloodstream. So seeing it here, this is the undeniable chemical proof of heart muscle damage. This confirms it.
But the investigation didn't stop there. A heart attack this severe usually isn't just a random event, a bolt from the blue. It's often the climax of a much, much longer story. And the next blood test revealed a huge clue about what was really going on behind the scenes. And here is that clue, 12.3%. This number is from a test called HbA1c. Think of it like this. It doesn't just show your blood sugar level right now, today. It gives you the average of what it's been over the last 2 or 3 months. It's the big picture.
Now, any result over 6.5% points to diabetes. This patient's level is nearly double that. That indicates severe, uncontrolled diabetes for a long time. And this is a critical piece of the puzzle, because chronic high blood sugar, it basically acts like sandpaper on the inside of your arteries, damaging them year after year, making them the perfect place for the kind of blockages that cause heart attacks.
So, now we have the what, a massive heart attack. And we have a huge part of the why, uncontrolled diabetes. So, it's time to visit the crime scene itself. It's time to take a journey directly inside the heart's arteries. And the way we do that is with a coronary angiogram. It is an absolutely incredible procedure. They inject a special dye into the heart's arteries, and then an X-ray machine watches it flow. What you get is a live-action roadmap of the heart's fuel lines, and it instantly reveals every single narrowing, every obstruction, every total blockage. All right, so on the left, you've got the raw report from the angiogram, filled with all kinds of medical shorthand. And on the right, you have our map, a simple diagram of the coronary arteries. So let's use this map to translate the report and see exactly what the doctors found in there. And the report shows that there is trouble everywhere. It mentions something called diffuse lesion, which basically means the disease is widespread. Specifically, the left anterior descending artery, this is a major vessel that feeds the front of the heart,
It has a 70 to 80% blockage. I mean, that is a life-threatening problem all by itself, but it doesn't explain the damage to the inferior wall that we saw on that first ECG. The main culprit was hiding somewhere else.
And then the angiogram revealed it, the primary cause of the chaos, the smoking gun. And here it is, the right coronary artery, the very artery that supplies blood to that inferior wall we heard about right at the start. It had a 100% occlusion. It wasn't just narrowed, it was completely sealed shut. No blood was getting through at all. This was the event that triggered the whole thing. So, with the electrical evidence, the chemical clues from the blood, and now a crystal clear picture from inside the arteries, the case is solved. Let's lay out the final verdict and see what the path forward actually looks like for this patient. The final diagnosis is something called triple vessel disease and left main disease. What that means is that all three of the heart's major arteries, plus the main trunk that they all branch off from, are severely diseased and blocked. It's one of the most serious forms of heart disease you can have.
Now, when the disease is this severe and this widespread, little fixes like putting in a stent, they just won't cut it. The only real recommendation is a major surgical procedure, a coronary artery bypass graft, or what most people just call bypass surgery.
So how does that even work? Well, imagine a massive traffic jam that has completely shut down a highway. You can't clear it, so what do? You build a detour. Surgeons do the exact same thing for the heart. First, they take a healthy blood vessel from another part of the body, like the leg or chest. Then, they use it to create a new pathway, a bypass, that goes around the blockage. Blood just gets rerouted through this new detour, and just like that, vital oxygen starts flowing back to the heart muscle again.
And that really brings our investigation to a close. It is pretty amazing when you stop and think about it, isn't it? How a few squiggly lines, a couple of numbers from a blood test, and an X-ray filled with dye can piece together the entire story of a heart in crisis. From its long-term struggle, to its moment of absolute failure, and, hopefully, to its path toward repair. Thanks for joining me on The Explainer. The story we uncovered today is just a powerful reminder of how modern medicine can read the clues our own bodies give us. Stay curious.